I'm Gayatri, your anchor for today's Cardio Kidney Metabolic Connect talk show held in Cardiology Conference in Kolkata. In our initiative to build mass awareness about cardio kidney metabolic diseases, which is impacting every Indian household in current time because of growing incidence of sudden heart attack, kidney problems, and diabetes. To throw more light on this, today we have with us Dr. Shiva Kumar, sir, from Hyderabad. Welcome to the show,
Yes,
sir.
India.
Sir, can you briefly introduce about yourself to the viewers?
I'm Dr. Yerra Shiva Kumar, Senior Interventional Cardiologist from Hyderabad, working as HOD, Mahavir Hospital Research Center, Hyderabad. Thank you welcoming us for the Cardio Kidney Metabolic Connect by IPCA.
Doctor, my question to you is, does our body warn us before a heart attack?
Definitely, it differs from the patient to patient. Age-wise is differ, and what he has, the risk factors are very important. Younger patient, most of the patients, they come with the gastric problem. So in that situation, you have to see that definitely it is different from regular symptoms. Definitely have to do the ECG search. But those who have the risk factors like diabetic, hypertension, dyslipidemia, elderly persons, they have a breathing problem will be there. SOB will be there. Are associated with the settings. Any pain who has the chest pain from starting from the mandible to the above the umbilicus, if you have the pain associated with the sweating and SOB, definitely you have to visit the local doctor and plan to do the ECG, basic ECG to be done, along with the cardiac biomarkers to be done. And if pain persists, definitely you have to continue to repeat the ECG every 10 minutes till the pain subsides. But three important factors, most of the patients have the chest pain, and elderly person, they may have the without chest pain, they may have the only breathing problem or epigas will be there. And in such patients also evaluated with ECG and cardiac markers still may require to continue to do the test. Whenever they are persisting pain is there, still it should be there in the hospital. So some patients may present with only vomitings. In such cases, vomitings, no other symptoms, still vomitings are there and sweatings are there. Definitely have to visit the local doctor. That is a basic point. Anywhere in that, now it is ECGs available everywhere, ECG to be done. And once the ECG changes are there, definitely you have to evaluate further with clinical examination to be done. BP is high, blood pressure is high, and other risk factors are there. Still more evaluation is required, but without risk factors you can wait. Particularly now younger patients having the heart attack, how to diagnose, particularly if you have the smoking risk factors are there, sedentary life is there, first in your life you are getting a different pain, definitely you have to visit the doctor. Nowadays younger patients are coming with a chest pain and epigastric pain, particularly they are coming late after heart attack, evolved anterior MI, whatever the evolved anterior. We can't do much in such cases. So you have to evaluate even those who have family history of cardiac attack. And in that patients, if you have the smoking, sedentary, obesity is very important, and mental stress, what we have now, it is also pollution. Those who are Hyderabad, what we see that even without risk factors of smoking or dyslipidemia, hypertension, diabetic, they are getting. But atypical pain, sweatings are important symptoms where you have to go to the doctors immediately at the earliest to do the test and evaluate for cardiac and to rule out the cardiac heart attack.
Thank you, doctor. Now, what are the options available, treatment option available for the patient right after a heart attack?
Now we are very fortunate because of development of many things, are invasive things or non-invasive is there. Once we have the heart attack, basic investigation to be done, ECG. Again, when they are doing that, once we are visiting the doctor, they will check the blood pressure, very, very important. He may diagnose that blood sugars is done. And once the ECG is done, same time, you are doing the cardiac markers, particularly TROP-T you are doing. It is wonderful things that those who have the TROP-T, definitely they have to undergo the invasive procedure and 2D echo. And once you have the regional valve most abnormality in the 2D echo, then he required admission and he may require the angiogram. Depending on angiogram, he has to do the revascularization. This, you have to clear the blocks by doing the angioplasty. By, again, after angioplasty, may require the stenting same time. Depending on the ECG, we can know that whether it is the acute coronary syndrome or STEMI. That is a commonly MI is there. In that, immediately primary PTCA we are doing that. Suppose their cardiac enzymes are normal, there is no ECG changes, 2D echo is normal, blood pressure is normal. In such patients, you may require later the treadmill test, where you are making the patient to walk on treadmill and rule out that whether he has cardiac problem. Suppose he has a treadmill test is negative, you may not require it. You have to do the lifestyle modification, strict lifestyle modification. And you should be evaluated lipid profile, blood sugars and blood pressures, and make them to have the regular exercise. That is, you have to follow the prevention methods. Same time, if you have the cardiac problem and treadmill test is he has, definitely can go CT angiogram. If risk factors are intermediate risk factors, suppose he has high risk factors, he can go the invasive angiogram. Depending on the angiogram, you can do the angioplasty or two vessel disease, single vessel, you can go angioplasty, PTCA that is called. If you have the triple vessel disease, you may has to go the bypass surgery by surgical procedure.
Doctor, now your message to the viewers for a healthy heart.
Yeah, healthy heart, not only the heart, you have to now the program what they have conducted is cardiac, kidney, metabolic. Just heart is not sufficient. You have to look for metabolic also, kidney also. All those things are important to do that. Blood pressure important, and you have to check the blood sugars, and not only blood sugars, you have to look that whether you are suffering with a lipid profile to be done. In fasting or non-fasting, can do the lipid profile. Other markers are there, definitely those who have family history of CAD, you have to look for lipoprotein A. Basically, always you can check if you have the family history is there, blood pressure to be checked. After that, fasting blood sugars, lipid profile to be done. Depending on that, you can do that. If you don't have any risk factors, you should not do the sedentary life is very important. And definitely nowadays you avoid the pollution, going in pollution also, and mental stress. If you do the strict life modification, definitely can prevent the cardiac problem, where at least 30 minutes walk to be done daily, and other exercise depending on your time and energy, you can do the strict life modification to prevent the heart attacks.
Thank you, doctor, for your
Welcome.
valuable advice on how to keep our heart healthy and also protect ourselves and our loved one from cardio, kidney, metabolic diseases. For more such information, log on to Cardio Kidney Metabolic Connect and Dil Se Dil Tak Healthy Heart Talk Show on Facebook, Instagram, YouTube, Twitter. Thank you.
Thank you very much, Madam Gandhi.